Assalamu alaikum warahmatullahi wabarakatuh. Good day to my viewers. I'm dietitian Aisha Yusuf, popular known as Aisha Nutri Diet. I play the game so that we can have something to do throughout this holiday. I selected some disease conditions and the vote was casted. I'm going to start with disease of the liver. The liver, we know, plays a very vital role in the body. And the location of the liver, we know, is the abdomen, the right upper part of the abdomen. It carries over 500 functions in the body, which include removing of toxins in the body, emulsification of fats, and so on. So, as people progress in life, things will happen that can lead to a condition that will lead to the liver failing. And the liver, when it starts failing, that is where the beginning of problem, because that person will start storing excess toxins in the body. The person's body will not be able to eliminate toxins. The fat elimination will not be able to take place, and other important functions of the liver. So, as a dietitian, I'm going to discuss some of the disease condition, the causes, and the dietary management. Okay, the first condition, it has to be, if somebody begin to experience liver failure, it could be due to hepatitis. And hepatitis is of three types. The major ones: hepatitis A, which is caused by hepatitis A virus, which is caused through contamination of the hepatitis A virus in food, water, or eating utensils. And then when somebody passes you and the hand is not properly clean, the person then shake hand with another person that don't have it, that person can contact hepatitis A virus, which will lead to hepatitis A. And then we have hepatitis B virus, which is caused by fluid. When maybe exchange of fluid between two people, or when you hug somebody that have it, kissing, shaking of hand, exchange of clothes, and so on, can lead to the contamination of hepatitis B virus. And then hepatitis C, which can be contacted through blood transfusion, through coming in contact with somebody's blood. Maybe there's an injury, the one that has hepatitis C with somebody that don't have hepatitis C will just come in contact, and that person can just get the disease. This hepatitis lead to liver failure. What really happens is that when these viruses goes into the bloodstream, they find their way to the liver, get into the liver cells, and begin to degenerate. The generator have lots and expand, destroying the cells, and then begin to feed the liver. The only solution to this is immunization. You get yourself immunized with hepatitis A vaccine, hepatitis B vaccine, hepatitis C vaccine, which is done by other medical personnel. And when it comes to dietary management, you change your lifestyle. Like, in order to avoid, prevent hepatitis A virus, one has to be extremely hygiene, personal hygiene. Your cooking utensils, your food should be properly cooked, especially seafoods. Seafood should be properly cooked, because when fish and other seafood like shrimps and crabs, they do have this virus in them, because when people that have it defecate into the sea, and these sea animals eat these defecates, and then people buy fish or one of these seafood, you don't cook it very well, the virus will still be there. So cooking of food properly, especially seafood, should be carried out to prevent hepatitis A virus. And also personal hygiene. And then for hepatitis B virus, apart from the vaccine, you have to be very careful how you hug people, how you kiss people, how you handle people's properties, exchanging of shoes, exchanging of clothes, borrowing of earrings, jewelry, and so on. Because once the fluid come in contact with each other, one can contact it. And then for hepatitis C virus, proper screening of blood before blood transfusion. Injection should be well sterilized, or new one, before injecting people. So this will help us to prevent these viruses. And then if these viruses are not prevented and somebody had it, it will lead to the heart to begin to fail, and accumulation of it will make the liver to become fatty. That means the liver can become fatty and damaged through hepatitis. And apart from hepatitis, the liver can also be damaged through alcohol intake, excessive intake of alcohol. You know, we all know 1 gram of alcohol gives up to 7 kilocalories. When you take excess intake of alcohol, so people take up to 1 kg of alcohol every day. That is about 7,000 kilocalories, and it is not used. It will accumulate into the liver and begin to become fat, producing fatty acid within the liver, and the liver will begin to fail. If one did not contact it through alcohol, there are people that don't even take alcohol, they end up having fatty liver, and they do not even have anything that have to do with hepatitis. By the time we ask them, we see that it's excess consumption of vitamin A or all these fat soluble vitamins food like carrots, or excess intake of iron intake food like the same liver from other animals. You all know that vitamin A or all these fat-soluble vitamins are stored in the liver, including iron. When it becomes excess, you know, the breaking down of all vitamin A, fat-soluble vitamin, that is ADEK, ADEK, is the use of fat, because they are fat solubles. So when they accumulate in the liver, they make the liver become fatty and begin to fail. If proper diagnosis is not taken for proper checkup to prevent the intake of too much fatty foods, too much excess intake of sugary foods, processed foods, salty foods, and also, you know, people that live sedentary life, then the liver become fatty. When this happens, the fat blocks all the pathway, and enough oxygen will not go into the liver for proper functioning, and the liver will begin to fail. And the liver will not be able to send signal to bile. Bile that has bile duct, bile that has the gallbladder that holds the bile to emulsify fat. You know, we said digestion of fat begins from the small intestine, the duodenum. By the time the liver send message to the gallbladder will secrete bile into the food consumed, and it will lead to the breakage of fat. That is when the metabolism of fat will begin. And when this happens, there will be proper digestion of fat. But when the fat is already fatty, there's blockage. So there's no message sent to the gallbladder to secrete bile. The bile is not failing, and there's no proper digestion of fat. That person will become will be diminishing, losing weight, not enough calories. That is why one of the dietary management for liver diseases is to reduce the intake of fat. If it is severe, we say you restrict fat, go for only good fat. That is the good fat, like the unsaturated fat that remove bad fat from the body, the fat that has omega-3 fatty acid. If we come to discuss omega-3, you will see how omega-3 fatty acid help to break down bad fat and flush it out from the system. And it's recommended at least 10 grams to 20 grams of fat is okay per day. And that fat should come from good fat, not bad fat. So avoid things like fat from animal products like butter, margarine, others, lard. Avoid them, they are not good. Go for fat from plant products like olive oil, cottonseed oil. They are good. They have enough omega-3 fatty acid, and they will help to remove bad fat, and the liver will begin to function back to normal. If proper care is not taken to remove this fat, it will then develop into what we call liver fibrosis. When you get to liver fibrosis, the Cooper cells of the liver fails the more. This time around, the person will begin to feel, the signs and symptoms in a very painful way. Where toxins are stored in the body, the person feels dizzy, the person begins to experience edema. That is a cyst within the abdomen. The legs begin to get swollen. The person's food are not digested very well. The person will go to the toilet and produce dark stool or pale looking stool. That means the liver is failing. So what we do at this stage of liver produces, we increase lot of fruits and vegetables for that person. But mind the type of fruits and vegetables. When we come to discuss the relationship between fruits, vegetable, and sodium, I will tell you, you will know the vegetables that have too much sugar or the vegetable that have excess sodium, the liver don't need it. you go for medium vegetable. Then avoid vegetables that have excess vitamin A, like carrots. Carrot has excess vitamin A, which will complicate the case the more. According to research and our Nigerian food composition table, we found out that 100 grams of carrot gives over 16,000 micrograms of vitamin A and over 8,000 micrograms of carotene. Combined together, carotene, which is the precursor of vitamin A, and it will be stored in the liver. And proper breaking down and uses of vitamin A do not take place, then it will damage the liver the more. If liver fibrosis is not properly cared for at this stage, it moves to what we call liver cirrhosis. This is where scars will appear on the surface and inner part of the liver, blocking every pathway. The blood that carry oxygen from the GIT system into the liver will be blocked. Thereby, the liver is not even having enough oxygen. Again, the liver is dying. Oxygen is life. The liver now is dying. No more removal of toxins, no more sending toxins to the kidney for filtration, no more sending toxins to bile, no more other breaking down of all these vitamins that need the liver, no more releasing of iron for proper production of red blood cells. So by the time you get to liver cirrhosis, there's something we call hepatic hypertension that takes place between the duct carrying oxygenated blood from the GIT, that is the duodenum, into the liver. This hypertension will block the oxygen going, and the capillaries that carry this blood will begin to get swollen. It will be getting swollen, and it will get to a state that will start breaking down. There's going to be hemorrhage within that side, and the blood will spread around the liver and the intestine and then go back into the intestine. That is why one of the symptoms we ask the person, do you pass out dark maroon color reddish stool? That is particles of the blood is inside. That means this liver is getting to a very more critical stage. If it is not properly maintained and cared for, to make sure that it stops at liver cirrhosis by asking that person to avoid salty food, sugary food. Protein should be within 1.2 gram to 1.5 gram per that person's age. Then the calories needed should come from carbohydrate. At least 40 to 50% of the calorie needed should come from carbohydrate food. Fatty food should be reduced drastically. And then the people should go for high anti-inflammatory agent food and high anti-oxidative agent food to prevent further inflammation. Where do we get anti-inflammatory food from? From plant origins. Protein, lean protein from plant origin. Our beans is there. You get it late to quantify it. They need quantification and add your rice to it. There should be fiber intake. That person's fluid should be increased. The person should take a lot of clear liquid diet from fruits and vegetables and water, so that it will start flushing out the toxin. That person, you see, the person will start passing out to urine, frequently removing toxins. If it is not properly cared for, liver cirrhosis will not develop into what we call hepatic encephalopathy. That is where the brain will be damaged, because all the toxins from the liver that is not excreted or removed out will then move through the bloodstream and begin to damage the brain cells. The person will go into coma. The person will have very big protruding stomach. The person's sight will be dim. The person hearing will be dim. That person will not be able to carry out most of that person's daily function activities. At this stage, even if they are common, when the doctors are playing their role, what are you doing, dietitian? They don't need any type of food at this stage. All they need at this stage is pure, clear, liquid diet. Pure, clear, liquid diet that is produced from fruits and vegetables like cucumber, cabbage juice, cucumber juice. You blend date, you mix date with apple juice, bring it out, and you keep giving that person. That will help that person to remove some of the toxins, and it works. It will both inflammatory agent, and then that person will begin to recover. And sometimes they even start sitting down and talk. If they cannot eat, you introduce tube feeding. That is why we teach you tube feeding as early as possible in 200 level. We teach you how you insert tube, and you start giving that person clear liquid diet through tube feeding. When a patient is sick and that person cannot eat orally, please dietitian introduce tube feeding, because food is life. Without introducing food into the GIT system, any mode of medication, either through intravenous or through injections and so on, will not work well. What are you doing, dietitians in this hospital? You talk, I want to introduce tube feeding. Then you begin to pass the clear liquid diet through tube, increasing the calorie, giving little glucose, so that without enough calorie, the brain will start not functioning well. It's one of the organs that need high calorie to start functioning. And then the person will be passing out urine, even if that person is unconscious, removing toxins. And you see that the swelling will be reducing, and before you know it, that person will start responding. But if proper care and dietary management did not take place, what follow? It becomes cancer. At this stage, the cirrhosis become cancer. This is a very, very life-threatening stage that it kills. And sometimes, the only solution is surgery and liver transplant. People ask, how do we transplant liver? As a dietitian, you have to know these stages to certain level. Even if you are not a surgeon, even if you are not an hepatologist, you are not the one that will do the surgery, but you know it, so that you can recommend. I'm a dietitian and recommending liver transplanting for this person. All they do is to get a lively, healthy liver, cut a little part of the lively early liver and transplant it. As God will do His wonder, Allah is wonderful. The liver generates by itself. If it's successful, the liver will start growing back to normal. They will remove the dead liver, put in new liver, little, and the cells will start growing by itself with proper dieting. There's no way all this thing will work fine. You will get positive results without dieting. Diet is life. Diet is medicine. No matter how you try to use the octos or the other medical way, I'm telling you, diet plays a very, very important role in solving liver problem. So this is what I have for you considering liver failure, with all these stages from hepatitis to liver fibrosis, fatty liver, liver cirrhosis, and hepatic encephalopathy to cancer of the liver. We can handle it through proper dieting. I am dietitian Aisha Yusuf. Thank you very much for listening and following me. If you watch my YouTube channel, please don't forget to subscribe and share. Thank you very much.